So hello, everyone, and welcome to the third annual New Jersey Youth Transition Conference. My name is Lisa Daup, and I represent the Camden County Partnership for Children on behalf of the Youth Transition Conference Planning Committee. Our keynote this morning presenters are Melinda Carnassale from the Children's System of Care, Deputy Director, and Jonathan Siefried, Assistant Commissioner of the Division of Developmental Disabilities. So we will have some Q&A afterwards with Alex Encarnacion, Assistant Director of the Office of Constituent Affairs. So I am going to pass it on to Melinda. Okay. Sorry, Melinda.
That's okay.
Okay, there we go.
All right. Good morning, everyone. It's great to be here. As you just heard, my name is Melinda Carnassale. I'm the Deputy Director of Operations for the Children's System of Care. And I'm here to talk to you about the Children's System of Care. If you want to move to the next slide, there's a brief overview of our agenda. So I'm just going to give you an overview of the Children's System of Care, or CSOC. We'll go over some definitions, eligibility requirements, and application for developmental disabilities. We'll go through some services for children and youth with intellectual and developmental disabilities, and then we'll talk a little bit about transition. Okay, next slide. CSOC is New Jersey's public behavioral health system for youth under 21 with moderate to high clinical acuity. CSOC was established in the early 2000s to serve youth with behavioral health needs. We then expanded our scope to include services for youth with intellectual and developmental disabilities in 2013. And then in 2014, we further expanded to include services for children with substance use disorders. The system of care is a coordinated network of services and supports that relies on youth and families being at the center of their own care, and aims to support youth and families within the community and with an approach that is mindful of cultural context, the social determinants of health, and how these impact families. CSOC contracts with a wide array of providers to deliver services and supports for youth and families. These contracted services are reimbursed with federal and state funds. Providers and partners are arranged in service areas aligned with the 15 court vicinages to assure seamless connections and coordination of care, particularly for youth with multi-system involvement. Although our service array is comprehensive, CSOC does not manage or authorize outpatient treatment services and does not have authority over admissions to acute or children's crisis intervention service units. Next slide. While CSOC is comprised of the 5 separate offices displayed on the screen, today we're going to focus mainly on the Office of Community Services, the Office of Residential Services, and the Office of Constituent Affairs. The Office of Community Services provides management and leadership for our community system partners and provider network service array. Their work strives to not only provide services, but to also expand access and cultivate supports within the community and build sustainable plans for the youth and families served. The Office of Constituent Affairs manages all internal and external inquiries for the division, including those from stakeholders, legislators, and families to ensure timely, transparent, and equitable responses to our constituent concerns. Finally, the Office of Residential Services manages our out-of-home treatment placement for children and youth served to ensure access to the least restrictive and clinically appropriate setting to meet the needs of youth and families in collaboration with our partner providers. Next slide. The Department of Children and Families is devoted exclusively to serving and supporting at-risk children and families. Among other divisions and offices, it houses both the Division of the Children's System of Care and the Division of Child Protection and Permanency, or DCP&P. We're often asked to clarify the roles and relationships between the two sister divisions, as well as roles of partners within the Children's System of Care. We provided this graphic to support this discussion. DCP&P is the Child Protection and Welfare Agency within DCF. Its mission is to ensure the safety, permanency, and well-being of children and to support families. CSOC serves youth with emotional and behavioral health care challenges and their families, youth with developmental and intellectual disabilities and their families, and youth with substance use challenges and their families through coordinated care, treatment, and intervention, whether or not they're involved with DCP&P. In fact, most children engaged with CSOC have no involvement with CP&P. CSOC is committed to service provision based on the youth and families' needs in a family-centered, community-based environment. CSOC encompasses state staff charged with management and oversight of the administrative, clinical, and support services provided by agencies contracted with DCF. The New Jersey Department of Children and Families contracts with Perform Care to provide access to publicly funded services through the Children's System of Care for youth up to age 21. Perform Care is the contracted system administrator, or CSA, for CSOC, and as such is the single point of access to an array of services for youth and families throughout New Jersey. Next slide. Perform Care is how families can access services provided by the care management organizations, mobile response and stabilization services, and family support organizations. Perform Care is also the access point to have a youth's DD eligibility determined, which then allows that child to access family support services, including respite, intensive in-home and out-of-home treatment services, which we will discuss a little later in the presentation. I would like to note that IIH and out-of-home require CMO involvement, while family support services do not. Next slide. In New Jersey, the role of the Children's System of Care in determining eligibility and the definition of a developmental disability are defined in DCF Regulations Title 3A, Chapter 40, Determination of Eligibility for Functional Services from the Division of Children's System of Care. As per these regulations, a developmental disability is a severe, chronic disability of an individual which is attributable to a mental or physical impairment or a combination of both, is manifest before age 22, is likely to continue indefinitely, results in substantial functional limitations in 3 or more areas of major life activity, reflects the need for care, treatment, or other services which are of lifelong or extended duration. Developmental disability includes, but is not limited to, intellectual disability, autism, cerebral palsy, epilepsy, spina bifida, and other neurological impairments. Areas of major life activity will be discussed later on in the presentation. We commonly refer to intellectual developmental disability. Intellectual disability is a subset of developmental disability. Developmental disability can be acquired or congenital. The origin of a youth's developmental disability does not need to be known in order for the youth to apply and become eligible for functional services. Next slide. In order to receive functional services, services for youth with intellectual developmental disability, the youth must first be determined to be eligible. If the child has not yet turned 18, you can access the application materials on the Perform Care website listed on the slide. If the family does not have access to a computer, please contact Perform Care and request that an application is mailed. For youth over 18, the Department of Human Services, Division of Developmental Disabilities is responsible for making a determination of eligibility. For more information on this, can be found by calling 1-800-832-9173 or at the New Jersey Division of Developmental Disabilities website, also listed on this slide. So to be clear, if a youth moves to New Jersey after his or her 18th birthday, they will have to be determined eligible by DDD in order to receive CSOC services. Now we will discuss the requirements for DD eligibility determinations. Next slide. The requirements for DD eligibility can be broken down into 5 components: age, diagnosis, functional limitations, citizenship, and residency. Let's take a closer look at these requirements. Next slide. Applications accepted age 0 until the day before a child's 18th birthday. On the 18th birthday and thereafter, applications must be submitted to the Division of Developmental Disabilities. Youth between the ages of 18 and 21 may be found eligible by the Division of Developmental Disability, but will receive services through the Children's System of Care until their 21st birthday. Although CSOC serves all youth between ages 0 and just before their 21st birthday, there are limited services designed for youth 5 and younger. If the youth for whom you are seeking services is under the age of 5, know that service availability will be determined by the care coordination team at Perform Care to ensure that the youth's needs will be met. Another option is to access services through the Department of Health's Early Intervention System for youth ages 0 to 3 statewide. Next slide. We've already discussed what a developmental disability is. It is important to note that the youth's diagnosis must come from a licensed clinician through an evaluation process. A diagnosis from a school representative is not acceptable unless they are also a state licensed clinician. A diagnosis written on a pediatrician's prescription pad is also not acceptable. Next slide. In order to be eligible for services through the Children's System of Care, a child must have substantial functional limitation in 3 of 7 areas. A diagnosis of developmental disability is not enough to warrant eligibility. Receptive and expressive language function, self-care, learning, self-direction, capacity for independent living, economic self-sufficiency, and mobility. A functional limitation occurs when a child is unable to do the things that most other children his or her age can do. This can occur in some areas of function and not in others. This is why the eligibility requirement is that they have a functional limitation in 3 of the 7 areas of major life activity. Please visit the Perform Care website for more information, including a video, a checklist, and other materials to assist the family with the DD eligibility application process. Their website is www.performcarenj.org. Next slide. The child and/or parent legal guardian must be a United States citizen or permanent resident with a U.S. birth certificate, U.S. passport, certificate of naturalization, certificate of citizenship, or a permanent resident card or green card. The child and/or parent legal guardian must be a resident of New Jersey. Families or caregivers of undocumented minors should contact Perform Care to discuss service options. Military personnel who are deployed to New Jersey are considered residents of New Jersey. Next slide. There are 3 ways to complete the application: through the Perform Care portal, through the mail, or also a combination of the 2. At this time, it is highly recommended that the application be completed online through the portal. This will expedite the process. Application materials are available on the Perform Care website in Spanish, Portuguese, Mandarin, Chinese, Korean, and Gujarati. They are also available in any language upon request. Next slide. CSOC and Perform Care have updated the timeframes for clinical assessment list, which is used as part of the intellectual and developmental disability eligibility determination process. The updated chart seen here displays a general guideline for timeframes for clinical evaluations and assessments that could be submitted to Perform Care regarding a youth's determination for developmental disability eligibility through CSOC. Diagnostic evaluations include evaluations by a licensed practitioner demonstrating existence of a developmental disability. Please note that additional evaluations and assessments may be required for an eligibility determination based on the documentation submitted. Next slide. Perform Care reviews applications as quickly as possible in the order that they are received. It could take up to 60 days before the application is reviewed, depending on the volume of applications received. Perform Care works to engage with families throughout the application process. Families will be contacted by Perform Care if the application is incomplete. Families will be advised as to what information is needed in order to complete the application. If an application is left incomplete and is effectively abandoned for 1 year, the application will be administratively closed. I would like to point out that a great deal of work has been done regarding the timely review of applications, and most determinations are now being made in under 60 days and many within 30 to 60 days. Next slide. Following a determination of not eligible, an appeal of the determination can be filed either with or without additional supporting documentation. You can reapply if circumstances change. Changes in circumstances may include a youth whose behaviors decompensate over time. New documentation may also be required, especially if it includes a new diagnosis. We do not deny an application without first conducting a face-to-face evaluation with the youth and family present. Next slide. Now that we've gone over the DD eligibility application process, let's discuss the array of services available to youth with developmental disability needs. They can access the same services as any youth, including the care management organizations, which provide comprehensive care coordination and planning for youth and their families with moderate and complex needs. Mobile Response Stabilization Services, CSOC's timely, face-to-face, community-based response component, and family support organizations, which offer a variety of services meant to support the parent or caregiver of a youth with emotional, behavioral, developmental, and/or substance use needs. Youth deemed DD eligible also have access to services designated specifically for their needs. These functional services include family support services and intensive in-home services, which we will now discuss in greater detail. Next slide. Family support services are designated to strengthen and promote families that provide care at home for a child or young adult. Please note that the application for family support services is different from the DD eligibility application. At this stage, the youth has already been deemed DD eligible, and all the family has to do is work with Perform Care's care coordinator over the phone. A care coordinator will work with the caregiver to determine which services they are interested in and which are appropriate. The application takes approximately 20 minutes to complete. Once complete, the Family Support Services application is valid for 1 year. Next slide. Family support services also include respite care, of which there are 5 types. Agency hired respite. A respite worker is recruited, trained, and employed by the qualified agency to provide social and recreational experiences to children in or out of their homes. The caregiver and the respite provider can work out a schedule that works out best for the youth and his or her family. Self-hired respite. Families recruit their own respite worker of choice. The family pays the worker directly and sends the paperwork in support of reimbursement to the provider agency on a monthly basis. Agency hired respite and self-hired respite can be provided for up to 60 hours over a 90-day period. Agency after-school care. This is provided by community-based agencies at an agency's site and not in the child's home. After-school care programs provide social and recreational experiences rather than educational programming. This service can be provided for up to 240 hours over a 90-day period. Agency weekend recreation. This provides social and recreational experiences for children out of their homes, sometimes including a community outing component, Friday evenings through Sunday. This service can be provided for up to 75 hours over a 90-day period. For agency after-school care and agency weekend recreation, it is the caregiver's responsibility to provide transportation. And overnight respite. This allows your child to stay overnight in a safe, short-term alternate living arrangement. Each youth may attend up to 15 days in a rolling 365-day period based on availability. Services must be provided in a licensed facility with round-the-clock supervision and care. Respite does not include daycare and childcare, services available through other resources, funding for the cost of a service animal, or ABA services. Next slide. Family support services also include educational advocacy. This is a service provided to IDD eligible youth and their families when the youth necessitates in-depth help with education-related needs. Camp. The process starts with the family and the camp having a conversation about whether the camp and the youth are a good match. Then the application must be submitted by April 30th. One-to-one aides may be available also if needed. Assistive technology. An assistive device is an item, piece of equipment, or product system, whether acquired commercially, modified, or customized, used to increase, maintain, or improve functional capabilities of youth. And examples would include travel chairs, walkers, and positioning systems. Vehicle modifications are assessments, adaptations, or alterations to an automobile or van that is the youth's primary means of transportation in order to accommodate the special needs of the youth and that are necessary to enable the youth to integrate more fully into the community. Examples include motorized lifts and ramps. Environmental modifications are removable, minor structural modifications to the private residence of the youth or his or her family necessary to ensure the health, welfare, and safety of the youth or enable the youth to function with greater independence in the home. Equipment provided in this category is subject to a maximum limit per child per 3-year cycle. Examples include widening of doorways, ramps, and/or grab bars and their installation. For all assistive tech, up to $11,000 may be spent within a 3-year cycle. This information and more is available on the Perform Care website. Next slide. Intensive in-home services are intensive interventions. Behavioral, clinical and therapeutic services, or individual support services utilized to meet the needs of youth with intellectual and developmental disabilities and their families. Intensive in-home services can only be accessed through the Care Management Organization or Mobile Response and Stabilization Services Unit. IIH essentials include the following. Youth must be DD eligible, must be enrolled in CMO or mobile response services, Family participation. Families are critical team members in the identification of needs, strengths, strategies, and reporting progress. Therefore, each IIH service requires caregiver and/or family commitment and involvement. It should be noted that not all eligible youth receive these services. Youth primarily get services through DOE and must use private insurance before accessing state-funded services. Medicaid-eligible youth with autism receive services through their MCO, which does not require an eligibility determination by CSOC. And just to review the service types, the behavioral services, or ABA, focus on decreasing challenging behaviors and improving the youth's self-regulating skills, communication skills, and adaptive skills. A clinician will also work with the parents to support the behavioral plan. This ranges from 5 to 17 hours per week, depending on the level of need of the youth. Clinical and therapeutic services focus on youth and family and provide cognitive and behavioral strategies to enable youth to function at his or her optimal level. It's provided by a master's level clinician and range from 1 to 4 hours per week. And individual support services address challenging behavior and skill development for basic activities of daily living. It teaches skills directly to the youth and trains parents in implementation of the individual support plan. This is provided for up to 10 hours per week. As with all CSOC services, these services are authorized in 90-day increments. Next slide. So what are the DD Crisis Stabilization and Assessment programs? This program is a short-term, community-based treatment setting that stabilizes youth with intellectual and developmental disabilities ages 6 through 20 years old that are in crisis and unable to be safely supported in their current living situation. There are 3 regional programs for each age group that service both males and females, ages 6 through 10, 11 through 15, and 16 through 20. Each program has the capacity to serve 5 youth in each home. Program objectives are to engage and stabilize the youth, provide comprehensive diagnostic assessments that result in the identification of an appropriate treatment setting, in-home or out-of-home, services, and supports that can meet the youth's habilitation and behavioral health needs upon discharge. This service is accessed by calling Perform Care. The referral can be made by the care management organization or mobile response and stabilization services. If the youth has not already been deemed DD eligible, the family must apply for DD eligibility as soon as possible. Next slide. While it is one of the goals for the children's system of care to keep youth safe at home in the community, we know that some youth will have higher levels of need requiring residential or group home treatment. This determination is made by the child and family team, which is comprised of youth and families, the professionals who work with youth and families, and their informal and community supports. The youth CMO care manager is responsible for managing the out-of-home referral process. This includes creating the out-of-home referral packet and submitting it to Perform Care for review, contacting programs once recommendations are made, and arranging meet and greet interviews. Next slide. DDD performs eligibility determination for young adults who will require services past their 21st birthday. Families are strongly encouraged to ensure that DDD eligibility process is completed prior to the young adult's 20th birthday. Because this transitioning process can take several months, we encourage families to begin the process early to ensure their young adult will have access to DDD services by their 21st birthday when CSOC services are no longer available. Families should contact DDD to receive additional guidance on the expected timeframe to transition from CSOC to DDD. DDD does their own eligibility determination for young adults who will require ongoing services. if a youth was determined eligible by Perform Care and the Children's System of Care, the family will most likely be able to complete the short application for DDD eligibility. The family should always contact DDD to get guidance prior to initiating this process. If a person applies for SSI and is determined to be eligible, they are automatically eligible for Medicaid. Collaboration between the Children's System of Care and DDD includes roundtable conferencing and data sharing. Roundtable conferencing for out-of-home youth. The CMO care managers meet with DDD regional staff on a monthly basis for planning the transition of youth in out-of-home placements from the Children's System of Care to the Division of Developmental Disabilities. Although these were suspended during the public health emergency, we have returned via a virtual platform. For non-out-of-home youth, the standardization of a monthly data sharing process is being developed. The division is actively working with Perform Care IT and DDD IT on a transfer protocol for the sharing of electronic records and information, which is still currently done by a live person from CSOC disseminating the information. Next slide. The division now has a dedicated mailbox for all DD to DDD transition specific inquiries. A parent and caregiver must be on the phone when calling Perform Care, but providers and advocates can be on the call with them to lend their support. The number is toll-free and available 24/7. The Perform Care website provides information, a video, a checklist, and other materials to assist a family with the DD eligibility application process. And once again, their website is www.performcarenj.org. I thank you for your time. I ask you to hold any questions till the end. And at this point, I'm going to turn things over to Jonathan. Thank you.
Well, good morning, everyone. Thank you so much, Melinda. I'm John Siefried, Assistant Commissioner of the New Jersey Division of Developmental Disabilities, and I work very closely with Melinda, Alex, Assistant Commissioner Green on individuals who are aging into the system in various states of that. So I'm going to share my screen and then do my PowerPoint, and then we'll do some QA. So let's see how talented I am at this. Okay, everybody should be able to see the just the main screen of the PowerPoint. Is that accurate?
Yes.
Okay, great. All right. So, as I said, I'm John Siefried, Assistant Commissioner of the New Jersey Division of Developmental Disabilities. I'm very happy to be here with you all today at the 3rd Annual New Jersey Youth Transition Conference. And the Division and Department of Human Services look forward to serving individuals that elect to come into the service system, upon eligibility and graduation. So our agenda today, just to kind of go over quickly, is I'll give an overview of the division, talk about eligibility, intake, transition, our assessment tool, the New Jersey CAT, the Jersey Comprehensive Assessment Tool, or NJCAT, our care management system, which is support coordination, our waivers, our services available through our waivers, and housing. So the Division of Developmental Disabilities, we serve about 25,500 individuals within the state of New Jersey, throughout the state. And these are, individuals eligible for our services. We operate several Medicaid programs that our services are rendered through and receive federal funding to support those programs. And I'll go over what those programs are, in a few slides. So our eligibility, as Melinda said, is largely the same, if not identical, to that of CSOC. The difference being that the Division of Developmental Disabilities, or DDD, serves adults with intellectual and developmental disabilities, typically age 21 and older, that meet eligibility requirements. As Melinda stated, and the same in the DDD system, our eligibility requirements are a level of meeting functional eligibility for a developmental disability, residency in New Jersey, and eligibility for Medicaid. And I'll go into some other elements. And we have an application process that we've worked closely with CSOC and our New Jersey Council on Developmental Disabilities Family Advisory Council to help streamline our application for services over the years. So, and this is the same as Melinda's information, but just worded a little bit differently. But just to restate, because it is important, to meet the functional eligibility for a developmental disability, there are a few components that need to be in play. First off, that the individual has a chronic physical or intellectual disability that began before the age of 22. The disability is expected to be lifelong, and the person, this disability causes substantial functional limitation in at least 3 of the 7 life areas that are on your screen. Those being receptive and expressive language, self-care, learning, self-direction, capacity for independent living, economic self-sufficiency, and mobility. Melinda had also mentioned, a short application. So here's a little more information on exactly what that means. So to be evaluated for eligibility for DDD, the person does have to complete an application to be determined eligible, and that must be submitted to the division. We have a full application, which is, we call our long application. That's used if a person did not apply previously for developmental disability services from either New Jersey DDD or the Children's System of Care, aka Perform Care. Or the person received a service to the New Jersey System of Care, which is Perform Care, but never completed Perform Care's application for the determination of eligibility for children under age 21. So what we did, because we do have a segment of individuals that we serve that, obviously CSOC is involved with, we stood up several years back what we call the short application. And this is an optional application, and I'll go, and it's for circumstances where the person applied before, the person applied before for developmental disability services through New Jersey Division of Developmental Disabilities and were notified that they were eligible, or the person applied for DD services through the Children's System of Care and were notified by Perform Care that they were eligible. In those circumstances, the short application can be used. And what that does is allows, rather than the family having to necessarily gather information they'd already submitted to the Children's System of Care, by completing the short application and signing that, we can solicit CSOC for what information the Children's System of Care is what CSOC is, for that information in an attempt to, just make the process a little bit easier for the family. If the short application is used, we will reach out to CSOC and get what information they have and then review that and then reach out to the family if there is additional information that's needed. But we will attempt to get whatever we can from the Children's System of Care. The completed application for eligibility, including all the forms, can be submitted in person to any of our community services offices, by mail to any of our offices, or by email. Email is a more common selection at this point, and it does make things a little more streamlined and perhaps easier for the individual or family completing the application. So I guess I already stated this, but the application can be submitted in person or by mail or by email. A family member or other interested person can certainly assist an individual in completing the application, but they cannot apply on the individual's behalf. The individual, if they are their own, do not have an appointed guardian, would be signing off on the application. They could certainly have someone assist. Or if they have an appointed guardian or legal rep, they could sign. But it's important that the legal representative for the individual is the one that signs the application if that is not the individual themselves. And then similar to CSOC, once DDD receives the application, it can take up to 60 days to process the application and render the outcome related to eligibility. And if an application is submitted, but we find to be incomplete or missing some required documentation, that can add some time to the process. But we will work with the families and individuals to help make that as easy as possible. Okay, a few words on transition. We do offer the division a graduate's timeline. I have some screenshots of that on the next couple slides, but that outlines the steps needed to apply for services and begin receiving home and community-based services from the division. There are some other tools that are on our website. We have a transition to adult light brochure in English and Spanish, as well as an individual and families welcome sessions flyer, both in English and Spanish, and a lot of other information that's available in our transition website. So just to kind of go over what that graduate's timeline looks like. It's 2 pages long, and this is page 1, but it's meant to, try to, be helpful and help families and individuals through the process. So it goes through, one of the division requirements is eligibility and enrollment in Medicaid, so that needs to be done. Application for division services, completion of our New Jersey Comprehensive Assessment Tool, completion of the Support Coordination Agency selection form. And then it goes further down the page and suggests what months you should be looking at this. And this is meant to be the year the person is going to be graduating. So to start doing, preparation and planning, September through June of the year before they're going to graduate. February and March through February, March, we suggest of the graduating year to complete the Support Coordination Agency selection form. Typically in April of the graduating year, the Support Coordination Agency will be assigned. And then April through June would be the time the support coordinator that the family or individual has selected to work with them on service plan development to have services in place in time for, for their, for after their graduation, when their school entitlement services will end. Okay, so I mentioned our New Jersey Comprehensive Assessment Tool. We use a standardized tool at the division to determine eligibility and to help support coordinators and providers understand what services are needed. It's called the New Jersey Comprehensive Assessment Tool. The acronym for that is the NJCAT. And that evaluates the need for support in 3 main areas. Those are self-care, behavioral, and medical. And the results of that assessment establish an individual's tier, which determines the individual budget that will be assigned to the individual from which they will use to purchase division eligible services. Our care management system and plan development scribes are support coordinators. That is the system that we use. These are independent contractors working for DDD Medicaid approved support coordination agencies, and they are required by the service definition and also through our federal requirements with CMS to complete regular monitoring. They're required to complete a monthly phone contact, a quarterly face-to-face meeting, and an annual face-to-face in-home visit. Once an individual has completed their eligibility application and they've been deemed eligible for division services, the intake worker provides the support coordination agency selection form. And then the individual can choose a support coordination agency that they wish to work with, or they can elect to be auto-assigned. And that's a randomization where our computer system would pick a support coordination agency for them. And again, once assigned, the support coordination agency would assign the support coordinator. They would be the person's case manager, and they would work with the individual and their family and their planning team to complete the person-centered planning tool and the individualized service for ISP. It's important to point out that once an individual is enrolled in one of our waiver programs, if they are not happy with their support coordination agency, they can choose to change one. We have a support coordination agency change form that the individual or their legal rep would complete and submit that to DDD. We would then, at beginning of the month, switch the support coordination agency. We have a list of approved support coordination agencies on our website. And we also work with our partner, the Boggs Center on Developmental Disabilities, who is our State University Center of Excellence on IDD. And they have some helpful information on selecting a support coordination agency and evaluating your support coordination agency services, if you so need that assistance. Only have a few more slides, and then we can move to questions and answers. So our waiver programs that we have at the division, we have 3 programs that are on your screen. So we have our supports program, and that provides an individual budget to each enrolled participant based on their New Jersey Comprehensive Assessment Tool tier, and they are provided services offered in the domains of employment and day supports and family supports. So that can be day services, employment services, respite services, therapies, etc. We then have a subset of the supports program called Supports Program Plus Private Duty Nursing. That is for individuals who are receiving private duty nursing or otherwise approved to receive through their Medicaid managed care organization. And there's an enrollment process for this. But individuals enrolled in that program will receive the employment day supports and family supports, but also be able to receive private duty nursing through their managed care organization up to the levels approved for by their managed care organization. It's important to point out that PDN is not a direct division service through our waiver. It is through the managed care organization. And then the final waiver program we have is called our community care program. That similar to the supports program provides services in the areas of employment and day and family supports, but also includes another domain of individual supports. You could also term that residential services. We do offer the ability to self-direct services in the family home, or an individual can direct in their own home. So that individual supports budget, could be used to fund, self-directed employees, or to hire an agency to provide services and supports. And an individual can elect, like I said, to self-direct those services or to receive services in a provider managed setting. So a special note on the community care program, enrollment onto that program is based on a person either coming up on our community care program waiting list or being deemed an emergency and meeting the level of care for that program. Being deemed an emergency means we have regulatory criteria, and that is homelessness or imminent peril. But outside of that, they would have to come up on the waiting list, and the level of care. Level of care means essentially that, but for enrollment on the community care program, the person would need to receive services in an institutional setting, such as a developmental center. The supports program is available to any person not enrolled on the community care program. And if a person is eligible for more than one waiver program, like supports program plus PDN and supports program, we do have staff that will offer options counseling at the intake process, or at whatever point eligibility for another waiver comes up. And that includes an overview of DDD services and managed long-term supports and services, or MLTSS, so that an informed decision can be made. This is a list of our waiver services. In the interest of time, I'm not going to go over all of these in depth, but we offer an array of services very similar to CSOC, from assistive technology, which can be a communication device, etc., environmental supports, which can be modifications rather, which can be a ramp on the family home, and then other supports like career planning, day rehabilitation, community-based supports, etc. And all of these services are defined in our waiver manuals, which can be found on our website. And then the final slide I have, and then we'll move to QA, is just around housing. This is a very, topic that comes up a lot, and very legitimately, because you can't live without housing. So the Division of Developmental Disabilities, we do believe that community living, is the cornerstone of an independent, integrated life in the community for individuals with IDD. To support that, we do fund rental subsidies for individuals living in provider managed settings like group homes, and those that elect to rent directly from a landlord, typical landlord. Individuals who receive a DDD rental subsidy are required to contribute a certain amount of their income towards rent. It's generally 30% of their income goes towards rent, and the subsidy will take care of the rest. The remaining rent, up to that published rent standard, is covered by the rental subsidy, and that subsidy is paid directly to the landlord. And we do that in collaboration with the HMFA and the Supported Housing Connection, which administers our rental subsidies. And I can get more information on that to anybody who's seeking it. So with that, I am going to minimize and stop sharing, and we can move over to questions and answers.
Wonderful, thank you. So we can go to questions and answers with Alex, or we can do some questions from the chat. However you folks would like to do it. Jonathan, Melinda, any preference?
No preference here. Whatever is the best rhythm for the group. We're just happy to be here.
Okay, great. Okay, so I'll shoot out a couple questions from the chat. How do families of students with intellectual disabilities but do not receive or are eligible for Medicaid get needed support services?
I can jump in from the adult system perspective. One of our requirements through regulation and statute for Division of Developmental Disability Services is Medicaid eligibility. It is through the Medicaid eligibility that we're able to enroll someone in one of our waiver programs, and the federal government funds 50% of every dollar that the state spends on services. The federal government then will pitch in, for lack of a better term, for that. So without Medicaid eligibility, we would be serving less individuals with developmental disabilities. So Medicaid eligibility is a requirement. And once someone turns, becomes an adult, they do become a household of one. So their family income may impact Medicaid eligibility before they reach the age of majority at 18, but they can apply for Social Security and Medicaid on their own once they turn 18. And so long as they don't have assets in their name or a job that income that is in excess of what the Medicaid requirements are, they would be eligible. I don't know, Melinda, if you have more to provide on that topic.
So this is Alex. I was just going to jump in really quickly. So we follow everything that Jonathan just said. However, there's a caveat that there are some public funds that the youth may qualify for that if they don't qualify for Medicaid, that would cover some behavioral health services. So we just encourage all the youth to get enrolled through Perform Care. And once they are engaged with the CMO will have them complete Medicaid application just in case to see if there's any coverage there. But we do have some services that the youth may still qualify for, even if they don't meet the Medicaid requirements.
Thank you. And I do just want to just state that that is in the children's system of care. On the adult side, DDD side, we don't have other funding that's available. Medicaid eligibility is required in the adult services.
Right. It's only on the children's system of care side.
Yep. Thank you, Alex.
You're welcome.
Great, thank you. That was the only question in the chat that wasn't answered. So I guess we could open it up for any other questions at this time. You can use your reactions to raise your hand or come off of mute, whatever works for you. Robert.
I just have a quick question for you. A general question. What if somebody who graduated from high school a long time ago and they're having a hard time proving that they had a developmental disability and they're in special education?
Well, I can certainly answer on the division side, and then Alex can help add in and elaborate more on the children's system of care. But we do have individuals of all ages that come under services. Some are older individuals that may have been in special education, but it was a long time ago and they don't have those records. What we would do is our intake unit, as they come through our application process, would work with them and see what information they do have. We do recognize that every case is different. We do have federal requirements. We do have to demonstrate that we have proof of disability before, that manifests before the age of 22. But we may be able to look at a conglomerate of different information to help establish eligibility. So each case is a little bit different, but we are going to do our best to help, make sure that we are able to serve the individual.
So meaning what you just said, collaborate or whatever it is. What do you mean by that?
I'm so sorry, and thank you for the question, and I apologize for not being clear. Just an array of different information. Maybe there's one piece from their pediatrician from when they were younger, and something, a document from the school district and a document from a neurologist. And through looking at all those different pieces of information, we can rely on several documents for eligibility rather than just one.
Okay.
It really depends on what the documentation is and what it demonstrates.
Okay. So the point that what I'm trying to ask is that what the point that I'm trying to make is that what if you have somebody who's in their 50s or 60s and they can't obtain their school records anymore? That's what I'm asking.
Well, and it depends on the situation. If somebody, let's say, has a diagnosis of Down syndrome, that's genetic. That would have had an onset. So we may not, in that situation, in that specific example, really need to go back and get something from the school district, because that's a genetic disorder that is, well defined and documented. So maybe with that, we would need something. We would then just need to go through functional eligibility. But for somebody with a different disability that may not have clearly had an onset before age of 22, we have to look at it differently.
Okay.
So that's what I mean by that. Thank you.
Okay. Okay.
Mhm.
All right.
Amy.
I have a question that was sent directly to me in the chat. This person is coming from the Jersey City Board of Education, and they're indicating that when reaching out to CSOC, they're being told that there's wait times of 6 months or more for people to access services. Can you clarify if that is accurate, or is there something, another way?
Can they specify what service they're talking about?
I believe they can hear you, so let's see if they respond. The person that's direct messaged me about this, you're welcome also to unmute yourself if you feel comfortable asking or clarifying your question. If not, you can continue to message myself or in the group chat, and we'll get that answered for you.
It would be helpful for some more details, because when a parent calls Perform Care, they go through, a number of questions and conversations to figure out what it is that the youth and the family is not only eligible for, but what would be helpful for them. You don't just call and ask, say, oh, hi, I want CMO. You call and have a conversation so that the care connector can kind of guide them through what their specific needs are. And then you're not necessarily placed on a waiting list. So I'm wondering if there's a specific service that they had in mind.
Yes, Melinda, they responded back to me indicating mental health support services for children. The initial visit is done in home, but support services have been an extremely long wait. It looks like maybe they're referencing that there's not a lot of maybe IICs or VAs and availability for in-home counseling service providers perhaps is short in Hudson. It sounds like that's what the case is.
So there is some variation throughout the state in terms of our IIC availability. And I mean, the quick answer for this is that we are in a workforce crisis overall, whether it's our IICs, our clinicians, our nurses, direct staff workers in our out-of-home providers. And this is national, right? We're in a workforce crisis coming out of COVID. So I think that's the high level answer, but yes, there's variation throughout the state. And as a department, we've been working on how we can best support all of our providers and all of our partners to best deal with this workforce crisis. But that's more of a workforce issue and not so much the services that CSOC has to offer. We have the services, but if the providers don't have the workers, then that's a different issue.
I have a follow-up question. Is there a way to prioritize anything based on severity?
Yes, I believe we do prioritize youth based on their needs. But again, this workforce crisis is something that we've never seen before. And unfortunately, I think it has been getting worse before it's getting better. So we've been meeting with our providers and I think trying everything that we can to best support them. And we're open to all suggestions as well. I don't know, Alex, if you had anything else to add to that in terms of the IIC.
Not really. I mean, you covered it all. We're trying. We are trying. I just saw something in the chat though that said no workers equals no service. Well, yes and no. I mean, it doesn't equal no services because we do have the services, and we, as Melinda said, it varies county to county, agency to agency. It's the amount of staff at those agencies that varies. So it's not that the services don't exist. Yeah, I don't know. I think Melinda covered it all, but I'm just see someone's writing back.
Well, and I do apologize. I was supposed to say at the 5-minute mark that we had 5 minutes left, and it's 10:01, so we're at time. So maybe we should wrap up. I think I'll just add on to the workforce issue. That is being felt in all portions of the care economy, not just in New Jersey, but across the nation. I talk monthly with the Pennsylvania and Delaware IDD directors, and New Jersey's not experiencing a unique phenomenon when it comes to workforce challenges. And that's not meant to be, an excuse, but it is the reality. Since COVID, and, I think no one can, probably reliably pinpoint exactly what it is, but just the behavior of the workforce has changed. We're seeing less individuals come into proportional to other places, healthcare, direct care kind of positions. And I know through the Murphy administration, and both of our commissioners, both Commissioner Beyer and Commissioner Adelman at DDD, we've been engaged in a lot of things to help to get there. One being the increase in minimum wage across the state of New Jersey. After January 1st of this year, minimum wage will be at I think a bit above $15 in New Jersey. And I recognize that's still an area of improvement that's needed, but for that legislation, we'd still be about the $9 mark, $10 mark in terms of that. We've also worked to do some, with CMS and our federal partners to do different things around workforce. So I don't want to belabor. I know I don't want to also. I want to be respectful of the presenters, the conference, other modules they have. So I'm not sure whether or not you want to, we should.
Thank you. Yes. No. Thank you so much, Jonathan. This is going to conclude today's keynote from the Children's System of Care and the Division of Developmental Disabilities. We want to thank you so much, Melinda, Carnassale, and Jonathan Siefried for sharing your knowledge and your resources, and also Alex and Encarnacion for answering any additional questions. So thank you so much.
Thank you.
Thank you.
Thank you.
Have a great conference.